So we're going to start with Alyssa. What does OPTIONS stand for?
OPTION stands for Overdose Prevention Through Intensive Outreach, Naloxone, and Safety. I almost paused on that one. It's an initiative through the Office of Behavioral Health and the Governor's Office. And we're contracted for several counties to provide overdose prevention by embedding substance use professionals with law enforcement to help connect people to services that they may need, from really basic harm reduction and naloxone distribution through supporting long-term recovery as well.
Right. We're gonna stay on you, Alyssa. Why do you think that OPTIONS is being expanded, and how important is public awareness and education in saving lives?
So I think the OPTIONS program is being expanded for a number of reasons. I think integrating recovery coaches is a wonderful way to really bring the peer communities together and provide a slightly wider range of services. And of course, having more people means that we could touch more people, which is really important. Public awareness and education is very important in saving lives. I'm struggling to come up with any reasons right now because it's 6 o'clock, 7 o'clock at night. But I think awareness, having the conversations, connection is the opposite of addiction. We need to be having these conversations. We need to be discussing what's available. And I think one of the reasons that OPTIONS is really special is that it's extremely low barrier. It's about as low barrier as you can get. We don't take insurance. My staff wouldn't know what to do with an insurance card, but we do help people get main care if they need it. But you don't have to use any specific substance or be in any specific place in your recovery. We meet everybody where they're at and try to move them forward. We don't leave them there. We meet people where they're at. We don't leave them there. Oh.
And final question, what does compassion look like to you in the recovery journey?
I think it's mostly about looking at an individual as a human being. I really like in the movie when Catherine is talking about her son, and she says, he was a beautiful person, and then it cuts to a picture of him as a baby. It just breaks my heart every time. I've seen this several times, but I think recognizing that every person has a story, has people who love them, they love people. See the person for who they are, not seeing their addiction, not seeing their behaviors in a vacuum, because people are whole people. And I think knowing too that but for some, seemingly random choices that I made, I could be in their shoes too. But for that one nurse who said something good to me, that one teacher who believed in me and saw something in me and said, hey, have you thought about social work? I could be anywhere right now. Literally, there was one professor who said, social work. And I said, I think I remember that from Judging Amy. Her mom is the social worker, and it's I can't think of her name, but she's a great actress. And I was like, I want to be like her. Of course, she worked for DHS and took kids away from their families. So that was her whole job. And I've learned it's different. But there were certain things in my life that not everybody had. I had advantages. I need to use my privilege to help others.